Good morning, everybody. That you are motivated to be here on a Sunday morning and on a subject which has not been discussed ever to audience who are attempting to join today. I've been told that I need to go slow for a few minutes only because many people who may not have known could only know it today morning. So while we attempt to unravel female urinary issues today morning, it is all that what every woman needs to know. Sadly, she doesn't know it and she continues to suffer. It's a story which has been happening 365 days around. It's time to wake up. So while you all join together on this important issue on a motivated Sunday morning, where you have given up all your work for next 45 minutes and you deeply immerse in female urinary issues, which needs to be unraveled to the audience who join in, I'm sure as time goes by, you will get to know that these are aspects which have not been dealt with and not being put on the public domain. It is important for us to know these issues, and therefore, because I gather the audience could be quite mixed, we could make it in English and in Hindi. I'll be very happy to take some comments on this. I'll be very happy in the end because this is an interactive show. Take questions on this, which is more important, right? Because female urinary issues are sadly not discussed. They're not discussed with the person who suffers. And many a times it stays not unraveled the way it is. So while I say good morning to all of you in this wonderful audience from the Kokilabenhospitalmumbai Hospital, from the Department of Urology, every woman needs to know her urinary complaints, which are there, which should not be postponed and should be treated by the right doctor in the city wherever you live in. The very good news is each of you happen to be an ambassador and each of you happen to be a pilot. The only bad news is time flies. So as we start this, we'll finish it very fast. It's all about remembering that the trouble that women have will not be over with this very important talk. But to make people aware and to bring about an awareness drive from Kokilabenhospitalmumbai Hospital, from a wonderful platform created by Reddy's Labs, Arvind and the entire team, we look forward to breaking this jinx of crossroads today. So while the global threat is not over yet and we are unmasking ourselves, we're also looking at the threat that women go through every day being a woman. That means they are at crossroads of an infection, an incontinence of urine, issues of obstruction, and aspects we could discuss as questions come in due course of time. So you are free to leave your questions before the end of the program. I could address few or many as time goes by. So to make women aware that they could be at crossroads on issues that they postpone or they ignore or are not aware of, we move forward today to look at unmasking the whole problem. So while I removed my mask on this, the menace of female urinary issues needs to be brought out to the society, and that's where we are attempting to look at greeting you from Kokilabenhospitalmumbai Hospital, where every life matters, is the motto. That's Team Urology at the Kokilaben Hospital. But today we are attempting to improve the quality of life of individuals who happen to be women. We don't discuss these issues so frequently. Therefore, today we've chosen some topics which are very, very important. They're important because it's only the sufferer who knows what she goes through. Sadly, we don't address this so frequently till somebody becomes a patient. And I'll tell you why every woman can become patient and how she can prevent herself from being a patient in future. So let's look at the agenda for the day, where time runs very tight for you and me today. Why am I motivated today on a Sunday morning or this Sunday morning to be taking up this is because the week that just got over was a week which was very epoch-making and historic. We had women who had recurrent urinary infections. We had women who had overactive bladder. We had women who were wearing diapers and pads for months or years. We had women who were getting up all night and sometimes bedwetting. And we also had women who had interstitial cystitis bladder pain syndrome, a disease which defies profile, somewhere where we need to probably wake the society and every individual and people who watch in today, that these kind of individuals suffer a lot. They suffer very silently and they sometimes suffer very loudly. Let's look into each of these individuals whom we saw last week, because the whole of the last week was a lot of women coming in. Let's not forget that there is March 8th, International Women's Day coming in. There is a week where we not celebrate, but make people aware on the Incontinence Week, which comes in. There is the World Kidney Day. So many awareness aspects happen. So why on a Sunday and why on these topics? But these topics are very silent agony to the sufferer. A sufferer of recurrent urinary infection continues to suffer with each episode of infection. The sufferer who cannot control urine would have to rush to the washroom, would not drink water, would be mapping toilets, or possibly be wearing diapers. Those who get up at night and pass multiple times a day don't know whom to go to. And interstitial cystitis bladder pain syndrome, where a bladder fills up and it's not behaving like yours and mine, but a bladder filling up gives discomfort and pain, is an entity or a disease that needs to be brought to public domain. So आज इन सब टॉपिक्स पे जब बात कर रहे हैं तो हम सारे लोगों को ये याद दिलाना चाहते हैं कि there is all that we do in urology. That could be my urology wall and the urology wall of all the urologists who look at various aspects. Each of the diseases have equal amount of priority. Like there is an incontinence of urine, there's a nocturia, there is interstitial cystitis, bladder pain syndrome, there is stress incontinence, and a whole lot of diseases that as a urologist, you and I would be probably going through a realm of treatment. But have we come a long way yet? I personally think not. The reason is we have not been so responsible enough to reach the society, partly because our timelines and work times are such that we are not able to make people aware on this. That could partly be a program for future for students who take up urology, take up medicine, that they would talk about general health to people also. They would talk about lifestyle diseases where people may not be enthused enough and diabetes goes uncontrolled, blood pressure goes uncontrolled, people turn obese, various issues of mental and physical health just goes out of control. But I'm here as a urologist talking to you regarding kidneys, bladder and prostate and women's health. So we're going down to the bladder and urinary issues. We'll focus too much today to prevent ourselves from losing control. That means infections, which are common to women, incontinence, which are very common to women, interstitial cystitis, which sadly is a women's phenomenon men do suffer with, and the urological community has not taken too much of cognizance of that. Nocturia, getting up multiple times at night, and bedwetting in elderly, and obstruction to the flow of urine, which again happens to women because of age-related changes. So women sadly suffer and suffer silently. It's time to break this jinx. It's time to break the shackles and the menace and come out of it. So we will look into all these aspects and look at all the case studies which will wake us up as to what is happening. Let's take an example and just thrash the example for us to know what could be the reality on this. Friends, we are speaking from the Kokilabenhospitalmumbai Hospital, and we're speaking on behalf of all the urologists in the country who represent the Urology Society of India. We're also looking at how do we make this happen for all our colleagues who are women in various cities who need to perhaps go and see their urologists in their cities. Let's talk about stress incontinence. So imagine somebody in her 30s, late 20s, 30s, who could be having leakage of urine after a delivery. So after a vaginal delivery, that child was born, things were happening well, and suddenly she has noticed that she leaks urine even on minimal stress. That's because of the pelvic floor stretch. The stretch of pelvic floor can happen to women, and this stretch can sometimes be troublesome. So she learns to see her gynecologist, she learns pelvic floor exercises, she gets a good amount of relief, and she moves on in her life, getting better and better, at the same time getting busier. Remember, if she did not get completely cured on that, and she sadly had another episode of progressive stress incontinence which could be related to age-related changes, or which could happen because of the next delivery, which happens a year or few years later, the problem of the pelvic floor stretch has not recoiled. A woman's pelvic floor is such that it undergoes a hormone-related change from 20s, 30s to 50s and 60s. That change, which is brought about by hormone relation with multiple deliveries, with changes that happen in a female pelvis, which is different from a male pelvis like a hammock, that change could sometimes be troublesome. So now that she has passed few years of living at a baseline improvement, but continues to have trouble, she now complains of leaking at walking, running, coughing. And if she is bending down for her prayers, she complains of leakage of urine. Remember, this is quite a disabling problem. That means she cannot play badminton anymore. She cannot play table tennis anymore. When she has to run and catch a best bus, she would leak urine before she can take the first few steps around. If she loudly laughs and cries around, she leaks urine. So that's quite disabling. This doesn't happen to men. So that's why female urinary issues are so important, because they are ignored, they are partly treated, or there is no awareness of this. And women continue to come back. So last week, when the clinic ended Saturday evening, I had seen close to 7 to 8 women who were having stress incontinence of different kind. If that is the amount I as a urologist see every week, I'm sure all our colleague urologists get to see. Perhaps we are guilty of not asking women, do you leak urine while you cough? Or perhaps we are scared to ask women, or women don't own up and tell their own partners, their own family members, and they continue to live in diapers, they drink less water, they are smelling of urine, they'll end up with infections. And this is a saga of a vicious cycle. So stress incontinence of leaking urine, when you have minimal amount of cough, which could happen very younger age group as a result of post-delivery changes in the pelvis, or later on, as a result of post-menopausal changes where the hormones are gone, the pelvic floor has changed, and women continue to leak urine, which had happened postpartum, continues to happen around. Women sadly suffer with this problem. This is quite a common problem. This is a very common problem. This has got a cure. So that's where we are. If it has got a cure, why are we living on diapers for a day, week, month, year, or a decade? It has got a cure completely where when you run, jump, laugh, cough, and bend down for your prayers, you don't leak any urine anymore. You are more confident. So building up the confidence is completely in your hands as an ambassador today and as patients who probably could know this, that stress incontinence is not about mental stress. Stress is about the compression which is given to the abdomen when you stress physically. So physical stress is all running, jumping, laughing, coughing, getting up the stairs, bending down to work or bending down for prayers. All that stress which you put on the lower abdomen or the pelvis sadly makes urine leak out. And that leakage is what is called as stress incontinence. So that was just an example to wake up us, all of us in this audience today, that anybody could be leaking urine. What does a doctor do? A urologist looks at you, examines you, does a sonography, does some basic investigations, and promises to cure you. And that's a great wow. If that can be done, I can be cured of my stress incontinence, and I could probably go and play again. I could take brisk walks. Otherwise, I'm not able to walk around. I leak urine. And that's something important. When I, across this very table where I see patients Monday to Saturday, look at it, I always talk about if you have a urinary issue, please don't postpone. Today's postponement becomes tomorrow's emergency. And that's what is happening to women who now finally wake up to umpteen issues around. So that you have an incontinence week, which is more of an awareness week. The whole week we talk about that in the month of July, in the month of monsoons. I know women leak urine for multiple reasons, but stress incontinence is all about stress on the abdomen and the pelvis, which causes leakage of urine, which could happen late 20s, 30s, which could happen in 50s and 60s. We have been operating patients into a 45-minute surgery where a woman leaves home in 24 to 48 hours without her diapers and is dry. She blesses the team and she says, thank you so much for waking me up and treating me, because I could not speak it loud to anybody, and I probably could not tell my partner, could not tell my family. I continued to live till one fine day it was picked up. So stress incontinence is curable, ladies and gentlemen. This is something we need to look into. Let's look at somebody else. Let's look at a younger lady with a different kind of an issue. Let's get into this picture. The terminology is overactive bladder. That means, for example, somebody has a bladder which is overactive. Like we all as an audience for the next 45 minutes are seated here. We know the bladder is under our control. I'm talking about the urinary bladder and not the gallbladder. And the urinary bladder is deep down in the pelvis where urine is gradually getting stored from both the kidneys. So both the kidneys actually produce urine, and that's not in our control. The urine gradually comes down. As urine comes down and gets stored in the bladder, then is your job starts. So your job starts when the urine is stored in the urinary bladder. Till that time, the kidneys govern you, and that's quite automated, like the brain and the heart. The urine is controlled in that bladder or a receptacle. We'll talk about that. And somebody cannot control urine. I feel like passing urine. I want to leave this lecture and go to the washroom because I have an urgency. I pass urine very frequently, and sometimes I leak urine. That is overactive bladder. Let's come to it. My friend and I don't go out very often because of my problem, Dr. Pandey. If we do go out, for example, to a departmental store, the first thing I look at it is I have to search a toilet. If I can't find one very close to where I am, then I would leave the store. I'll go somewhere else because I know that my bladder can be overactive and I am a slave and my bladder is a master. That's reverse for all of us in this audience today. We have a bladder which is under our control. When I decide I will walk out, I'll go to the washroom, I'll unzip myself and I will pass urine. That is what the relationship it is between me and my organ, which is under my control. My nights are also 3 to 4 times waking up, etc. So basically the bladder here is under control. The bladder decides because the bladder is overactive. ये शैतान बच्चे की तरह बार-बार contraction करता है और ये हमारे control में नहीं है. This is something which is sad, and this is so young. It's somebody as young as 27, which means that somebody at the age of 27 also can be disabled, and she could be a banker. She could be somebody who could be traveling all the way from Dombivli to Virar and Dombivli to Nariman Point for a work, and she has to get down at Andheri to pass urine before she is able to reach. In other words, women don't know what to do next, and many a times they would not drink water. They would map their toilets and pass urine before they leave a building, or they would wear diapers lest they don't know when the bladder would get overactive. So that's a phenomenon which actually afflicts women more than men. Youngsters, mature, geriatric, elderly, anybody can be affected with it. Other people, unfortunately, are not able to speak about it. So a case study of overactive bladder is to wake up women folk in this country that your bladder could be just overactive. I'll tell you, men have a different kind of overactivity of bladder too, but women have got these changes happening as a result of the inner lining of the bladder undergoing definitions. We'll come to that in a short while, but just want to break free from here and move to the next one. Somebody has got nocturia. She is 57 years young, and she says that having this problem is really bothersome, Dr. Pandey. Once in 2 hours at night, I have to get up, whatever happens. I get these episodes of 4 to 5 times getting up at night. My sleep is really disturbed. My days are all drowsy. I just got promoted as the CEO of the company. I need to be busy morning till evening in my office and thereafter on my phone. And I'm not able to concentrate because if I've been awake the whole night, passing 4 to 5 times, I don't get a good sleep at night. My days are really drowsy. I need to really take charge. So that's not uncommon phenomena. It may not be so uncommon in 30s, 40s, but beyond 50s and 60s, when we are postmenopausal, when we are that age group, as both men and women, we get up multiple times at night because of 2 big reasons. Number one, our sleep is milder and lesser at night at that age group of 60s and 70s. Number one. Number two, we produce more urine at night. So there's no way we can blame anybody. It is we who is going through the problem. I, in 10 years' time, will look at a similar situation for myself. And for all those who are in the 50s and 60s, life will change dramatically. Though it's year by year that we cut birthday cakes and probably get less younger mentally, but age is changing and that graceful aging brings about changes. So she at 57 is going through a trauma of getting up multiple times at night. बुजुर्ग लोग रात को करवटें बदलते रहते हैं because उनको नींद नहीं आती, वो जगे रहते हैं और उनका ब्लैडर बार-बार भरता रहता है. So if you are awake whole night, you're going to pass urine multiple times at night. If you have a deep sleep and your bladder wakes you up because there is nocturia. Nocturia is having more urination happening at night. These are aspects which women go through, men go through, elderly women go through. I talked about a 27 years young baby who has to look at her bladder because if that is so, she cannot control urine at odd times and odd locations. So from 27 to 57, we have women in the prime of their life in this country where people are really taking charge, and probably it's all women's era right now. It's important that the women's urinary health also gets taken around. Let's move forward to another case study of a disease as deadly as interstitial cystitis. I tell it as deadly because it is quite lost in oblivion. It is an entity that we need to wake up to. Each of us who listen to this slide need to be aware that interstitial cystitis bladder pain syndrome is an entity where holding urine is painful. None of us in this audience would have trouble holding urine. There may be an urgency and would say we can postpone it. We are in a bus, we are on a road, we don't have a toilet close by, we can postpone it by a few minutes unless our bladder is overactive. But out here, holding urine in the bladder is painful. That means the bladder is gradually filling up for me and you. And as it gradually fills up, like a bag being filled up with all kinds of stuff when you go to the Star Bazaar, the bladder is not crying, the bladder is silent. But for her, the bladder is painful. That means when the bladder fills up, she gets a pain, she gets a discomfort. That discomfort is what makes her go to the past urine. Don't think this is a rare disease. This is sadly getting there, and women suffer. And as I and my colleagues who happen to be center of excellence for these kind of diseases come to see this, we get to see that more and more people suffer from this, but have not known themselves. And possibly many a times our medical colleagues in different fraternity may not have known that. So while it's a wake-up call for many women who know that if bladder is filling up and it's painful, it is possibly something wrong. It's just not a UTI. We'll come to that. There is some degree or there's a complete relief after passing urine. So जब मेरा bladder भर रहा है और जब पूरा भर जाता है तो बहुत दर्द होता है और तब मैं यूरिन पास करने जाती हूँ. लेकिन मैं यूरिन पास करके आती हूँ, मेरे को बिल्कुल रिलीफ मिलता है. Somebody else would say, when my bladder is full, I have a sensation, I have an urgency, I need to go and pass urine, and my bladder is empty. So imagine two different women altogether. Somebody has pain, discomfort down there, she can't describe it very well in the language that's known to her best in the city where she lives in. She goes and meets her physician. She goes and meets her gynecologist and a urologist, but she's not able to describe it. It's very difficult for her. And many times they even don't go there. She can complain of burning sensation, discomfort in the pelvis not related to urination. Urine हो ना हो, वहां नीचे बहुत जलन हो रही, बहुत दर्द हो रहा है. उसके urine से कोई ताल्लुकात नहीं. And this is a long-standing problem, Dr. Pandey. I have this for last 3 months or 3 years or even 3 decades. I'm suffering from this issue. I've attempted treatment and I've given up. But I have got intermittent flares. And it's worsened whenever I get urinary infection. That's a modern woman who could walk to the clinic and tell me in Kokilabenhospital. Or that's the kind of woman who suffers in Jammu, in Nagarkoil, in Meghalaya, and in Rajasthan. They continue to suffer. So I am dwelling on this slide deeply because interstitial cystitis bladder pain syndrome is about agony more of women than men. And sadly, this has been missed out in this entire aspect of treatment. So let me wake you up to this slide and this subject in the next few minutes. Is that women get UTI more frequently than men, will be the next slide, where urinary tract infection is more common. And urinary infection can actually worsen the bladder phenomena altogether. That means when there's an infection, there is burning, pain, urgency, discomfort. If it spreads to the body and to the kidneys upstairs by an ascending phenomena, then you'll end up getting a pyelonephritis or a serious infection where you have fever. And essentially, you will then have to be admitted. There are injectable antibiotics. So the whole saga goes on. So urinary tract infection can worsen interstitial cystitis. And therefore, they get these intermittent flares and reliefs around. So we treat the UTI, the woman's aspects are cleared and she gets stable, but she continues to have pain while bladder fills up. And this is not a 1 day, 1 week affair. This sadly is happening for months and years. And this is a disease which probably holds quite an importance today, because you can't let women suffer with pain while passing urine, pain when the bladder is filling up. Is there something happening inside? For example, imagine this mouth is the urinary bladder. The inner lining is what senses, and the outer lining is what relaxes and contracts. So imagine your urinary bladder is a similar phenomenon. You have a urinary bladder where inner lining has sensations and outer lining has relaxation and contraction power. If the inner lining is diseased, or if the inner lining is not the way it should be, there is a ulcer in the mouth. It will be burning all the time, even if I drink water or take a sweet dish. Similarly, if the bladder's inner lining is having some ulcerations, some disease processes, loss of the lining of the bladder wall, what happens is the woman continues to have discomfort, because the urine touches the inner layers. It touches the interstitium and gives an inflammation called as cystitis. And therefore, it's called as interstitial cystitis, which largely today is a picture called bladder pain syndrome. Women continue to suffer. Sadly, we start giving them painkillers. Sadly, in this country, we start giving them urinary tract infection treatment. And that's where everything goes wrong. She has got overactivity of her bladder because the bladder is not listening to her. It's painful. She has got a forced frequency. She goes and passes urine very frequently. So there's a forced frequency. Bladder is contracting because the bladder is in pain. The bladder has got inner lining, which is inflamed. So the bottom line for this slide and this disease is, if somebody is having pain while bladder fills up, if somebody has got pain when the bladder fills up to full level and she cannot hold urine, and therefore she goes to pass urine more frequently because of pain while bladder fills up, and she gets some relief when the bladder empties, it is interstitial cystitis bladder pain syndrome, unless proven otherwise. There are many diseases which could give a similar kind of picture, but that's where your urologist is keen to pick it up. He's keen to pick up and listen to your complaints. And therefore, in quality of life diseases, the doctor wants to listen to you. Out here, you're listening to me speaking because I need to make you aware. But at the same time, when complaint is there of an individual whose ambassador you happen to be, it's important to speak up and probably tell them it's not about the report. Let's look at the first topic which I was supposed to speak is recurrent urinary infections. And I was talking about this, that women develop more urinary infections than men, only because of the anatomy which God made. Perhaps God was a little partial in terms of making the kind of anatomy for men and women. And in women, the urinary passage and the urinary bladder have got no bacteria, like in men. But just behind that, the vagina and the rectum is full of bacteria. That means the introitus, or the opening of the three passages which are close to each other, is an area which is potentially contaminated. That means women are at the threshold of urinary infection if they're not aware of something called as a hygiene to very high levels. That means bacteria are waiting outside the door, and they could easily walk into the urinary passage and cause infection, provided we are aware that we maintain the hygiene to very high levels and don't let it happen. So young women post-marriage, post-sexual activity could develop recurrent urinary infection because of the sexual hygiene not known to them, where they need to wash up, clean up the whole area very well, pass urine before to go to sleep that night, rather than developing honeymoon cystitis. That's a very important aspect to wake up. On the other side, elderly women, women who had hormones, and the hormones were the great support, which was in that area of the introitus, where a urinary passage, the vaginal passage and the motion passage open up, takes control completely of that urinary passage area, with hormones keeping everything quite logically happening well. But as they become perimenopausal and postmenopausal, the hormone effect goes away. The areas dry up, the areas atrophy. As a result of that, the guard gone away, bacteria can now easily walk in compared to what it was in the past. So a younger woman may not get a urinary infection. She maintains a great hygiene as talked to her. She knows her sexual hygiene, and she has got the hormone supports. Her anatomy is great. That means her urinary passage is still broad and good. Her bladder contractions are good. The coordination between the bladder and the outlet is good. But what happens to a post-menopausal lady, a lady who is in her 50s, 60s, 70s, and 80s? The hormones have gone away. The urethra, which is now tightening up, the passage is atrophy. The bladder may have a different mind of its own right now. And the bacteria can now easily walk into the room. There's a common area between the three areas and can easily walk into the room, and therefore they can develop infection. That's one. Because the passages are tightening up, many women may not be able to empty her urine, and they have got obstruction to the flow of urine. A topic that I'm not touching in details today, but women also develop obstruction to the flow of urine in their 40s, 50s, 60s, and 70s. The urine does not flow out very well. And if it does not flow out very well, urine stays back in the bladder. That means there's incomplete evacuation. I don't empty my bladder completely, Dr. Pandey. I pass urine, but something always stays behind. And that's the sad news. If you know that you're not emptying your bladder completely, the urine that stays in the bladder may cause infection. Women who are diabetic, we never discussed this, but women who are diabetic and long-standing diabetic and uncontrolled diabetic can develop infection every day, partly because diabetic happens to be an immunosuppressed state on one side. On the other side, because of diabetes and because of urine being staying in the bladder, and because the bacteria can more easily walk in around, infections are more common in diabetic women than in other women, number one. Infections are more common in elderly women. I didn't say elderly means 70s and 80s, but postmenopausal women than in premenopausal women. Premenopausal women could develop infection because they're not aware about the urinary passage and the sexual passages, and they can develop UTI because of the sexual activity and the post-hygiene not maintained at all. So recurrent urinary infections happening again and again. By medical definition, it is more than 3 times a year you get an infection, but sadly, women are at the brink of getting infection every day. So can we prevent this happening? 1 in 3 women would develop an infection in their lifetime for sure, and sometimes it can be threatening. Infection is just not about fever and urgency and recurrent episodes of it. Infection disables you, both physically and sadly also mentally. Let's talk about this. So burning sensation while passing urination, not about burning sensation in the introitus and the pelvis. That could be more related to the heightened sensations there. That could be more related to interstitial cystitis.
Doctor, you went on mute, sir. I would request you to please unmute, sir.
When did I mute myself? Am I fine now? Hello? Yeah. So, of recurrent urinary infections can happen as a result of being a woman. Recurrent infections can happen as a result of hygiene practices which are not known. Recurrent urinary infection can happen when post-menopausal, the area can tighten up. And as a result of which, the urethra becomes tight and the urine doesn't empty completely. So, burning sensations at urination can happen around. Pain while passing urine is again another important aspect of infection. People can have urgency, people can have episodes of trouble, and that is something which should not happen. So it is important for us to wake up to the phenomena that women develop more urinary infection than men, only because of the kind of anatomy that they have, where a urinary passage internally and the bladder doesn't have any bacteria, but the introitus or the external aspect has got bacteria around, and that is something which can always walk in and cause infection. So if somebody has got burning sensation while passing urine and somebody has got pain while passing urine, somebody cannot control urine, there's an urgency, and sadly also lands up with fever, that means it's a severe kind of urinary infection happening around. The first thing is to see a urologist. The first thing is to look at getting a symptomatic relief and getting a cure. We don't treat only with urine reports all the time. We also look at patients' complaints. Now let's look at the urine report talk. Many a times women and men don't know how to give a urine sample, which is the most important aspect of this important slide. You may not know that the introitus is soiled and the external passage is soiled. So if you are giving a urine sample, which is not a clean catch specimen, you may get a wrong report. For example, let's look into that. How do people give urine sample? They get up in the morning at 6 o'clock, the bottle is supplied to them, they pass urine in that and the story is over. That's not true and that's not right. What we need to do is we need to give a midstream and a clean catch urinary specimen. Only because the outer part of the urinary passage is contaminated both in men and women. In men who are circumcised, lucky. But in men who are not circumcised, their prepuce has to be pulled back. They need to wash up, clean up, and only give the middle part of the urine without touching the bottle. Women have a similar issue. Their introitus is soiled with vaginal and rectal bacteria because they're all sitting out there as friends. We wash up the whole area very well before we start passing urine in full bladder. And as we do so, the middle part of urine is only taken in the bottle without touching the bottle. So whenever you give a urine routine report and a urine culture report, you're always giving a midstream and a clean catch specimen, please. It could be at 6 o'clock in the morning. It could be at 10 o'clock in the morning. It could be even at 4 o'clock in the afternoon. In other words, if you see me at 10 o'clock today morning, you won't wait till tomorrow morning to give a urine sample. It could be the labs which have a different bias altogether. But preferably urine sample is in the morning, But if you have got episodes and difficulty today, you won't wait till tomorrow. So urine samples are always midstream and clean catch specimen. पूरे एरिया को अच्छे से क्लीन किया, पेशाब करना शुरू किया, पहला पेशाब छोड़ के सिर्फ बीच का पेशाब ही बॉटल में जाता है, बिना बॉटल को टच किए, बिना सॉइलिंग हुए. Very important for us. But remember, recurrent urinary tract infection is not about urine report. She's getting recurrent episodes of acute infection, which has to be broken. And that breaking the jinx is about identifying the cause. And therefore, identifying the cause is related to the age and related to aspects and practices. I told you, younger women can develop infection more so because of hygiene issues and sexual practices. Maintaining great hygiene is required for younger women, partly because their anatomy is still very good. As they become perimenopausal and postmenopausal, the urinary passage would tighten up. And as it tightens up, the bladder will not empty completely. अगर कोई है जिसका पेशाब खुल के नहीं आता, it's very important for us to know कि खुल के नहीं आना मतलब रास्ते में रुकावट हो रही है. जैसे पुरुषों में प्रोस्टेट बढ़ के रास्ते को रुकावट करता है, वैसे औरतों में पेशाब का रास्ता सिकुड़ सकता है. Partly because the hormones are taking their own effect. As a result of loss of hormones, the area dries up. There is a vaginal atrophy, and urethra happens to be opening in the vaginal area where the whole thing dries up. Bacteria can now easily enter because there's no guard and you can get infection. I think that's the crux of the matter today, that anybody who has got burning sensation while passing urine, who has got pain while passing urine, possibly could be landing up in an infection. She needs to see her urologist in time, and we get to see this all 7 days a week. Somebody comes to the outpatient department, somebody comes to the emergency department. Urinary infection does not always stay in the bladder. It can go all the way from the bladder up to the kidneys and into the body. That's when you land up with fever, with chills, with pyelonephritis. Let not that happen. That means if today you happen to be an ambassador in the subject as a woman, you know that I would not let urinary infections happen. I would tell my urologist my complaints, and he needs to identify. For example, somebody in her 50s and 60s comes and says, I'm getting urine infection again and again, which is sadly common. I ask her, are you a diabetic? She says, yes. Is your diabetes under control? No. How long is a diabetic? 10 years. You're already post-menopausal 10 years. The hormones have gone over 10 years. So that is against you. Your diabetes is long-standing, that too not under control. I ask her, are you constipated? She says, yes. So the bladder and the bowel emptying phenomena is not doing well. I ask her, do you empty your urine well? She says, no. I ask her to go and do a uroflowmetry, passing urine in a computerized toilet to get an ECG of the bladder. Like you have an ECG of the heart, which tells all about your urination. There's something called as ECG of the urinary bladder called the uroflowmetry. So in the privacy of the washroom, when you go and pass urine, the graph is recorded by a computer which tells me how do you pass, how much do you pass, and what is left over. You would argue and say, ultrasound tells me the same situation. Ultrasound doesn't say how you pass. And that is what matters. How you move out of the room. Do you walk out of the room? Do you run out of the room? Or do you stagger? Matters around. So if you're passing urine very well, that means you're emptying your bladder well and nothing is left over, you may not develop an infection because you're maintaining hygiene. The thing reverses in 50s, 60s, and 70s for women who are diabetic. So all our elderly mothers and grandmothers who have got urinary changes happening around, and we're busy treating them with urine cultures, I think we're doing more wrong. It's a crime just to look at urine cultures and treat them, because you need to go to the cause. If you're going to treat the smoke, the fire will still burn. It is important to go down and probably engulf the fire completely. So all urinary tract infections have a cause. In premenopausal younger women, the causes are different. In postmenopausal women, it's also different. Many women with stress incontinence wear diapers, and diapers are a double-edged sword. In one way, they give you the relief that you have in public places and the confidence building till your doctor actually treats you and cures you of stress incontinence by a surgery. And it's important to wake up. So while you're looking at these case studies and waking people up that urinary tract infection can be treated and can be cured, recurrent urinary infections have a cause, and the cause has to be picked up. Is it a urethral stricture? Is it uncontrolled diabetes? Is it a blockage of urine? Is it probably not emptying urine completely as a result of bladder outpouching? So there are causes which can be picked up completely. Similarly, overactive bladder, which I was talking about, is all about the bladder being just overactive and not listening to you. It just makes you get up and go to pass urine. If you don't reach, you may leak urine out, which is called urge incontinence. We'll just open the subject now for all of you to understand that urinary incontinence is a condition where there's involuntary loss of urine, and that's a social and a hygienic problem and objectively demonstrable. That means somebody coughs, I can examine and identify she's leaking urine when she coughs, and that has got a cure. So if somebody comes over, I examine her and look at the urine leaks out when she coughs around in an examination procedure. We do a set of investigation as urologists in the country. We pick up the cause, we pick up the findings, we look at associated abnormalities, and we treat and cure them. So if urinary incontinence can be treated, look at what happens to female urinary issues. How do you describe quality of life diseases in India? Like the incontinence of urine, infections, and obstruction. The prevalence is very high. I was talking about N number of women who saw us last week in my clinic and the clinics across the country. The impact on quality of life is amazing. You go through diapers, you go through not drinking water, you go through burning sensation, you go through pain while the bladder fills up in interstitial cystitis. And sadly, many women don't go to urologist. They go to everybody else. We'll talk about an Asian study. But this disease is underreported. All these diseases in female urinary health, not in the kidneys, down there, the urinary passage is underreported. You don't report it to the right individual. And therefore, they're underdiagnosed. They're not studied well, they're undertreated and unnoticed. It just goes unnoticed. And the prevalence in India is no less than the world prevalence. What women suffer in Europe and in America is women suffer here. A lot related to the anatomy and the practices and the awareness aspect. None of them are rare diseases. Remember, last day of February is called a rare disease day. You can open up that and you will not find infections and incontinence and interstitial cystitis as rare diseases. They sadly are common. So in other words, if we wake up to a phenomena that we go through common diseases, they should be treated, they should be cured, and it should be brought to the end rather than women suffering around. So as changes happen in 2022, men, women take up machines, take up medicines, and are motivated to get treated and do better in this era where we have learned ourselves. The health journey should not be punctuated by a green and an orange and a blue and a red stop. That means I should not keep getting leakage of urine every day, every week. I should not get urinary infections every month. And I should not get into aspects of discomfort which a urinary issue gives me. My health journey should be straight. It should be better than what it was in the past. And therefore, friends, magic is something you make. In the journey of the health pillar, it always seems much more valuable when we lose it. So let's not lose something and then look at it. It is important to take charge completely and get to the understanding of it. Now, I know as a urologist, all urologists treat kidneys and ureters and bladder and urethra. Our talk today was of the lower aspect. The urethra, which is only a short 3.75 to 4 centimeters pipe through which urine comes out of the body, which undergoes change as a result of hormone changes or accidents or traumas or various kinds of injuries which can happen to it as a result of surgeries and all. The urinary bladder is a conduit. And let's talk a little bit about urinary bladder. While I leave this and you get to know where your organs are, let's look at the urinary bladder. I said urinary bladder is like a storage organ. Like this is a storage organ. It can store as much food or water inside and then could probably drink it off or spit it out. Similarly, bladder is a kind of a balloon. It has great capacity to stretch. Therefore, don't overstretch it. Don't overstretch beyond a point in time because it could then lead to aspects which I will talk about. So if you feel like passing urine, excuse yourself. Go and pass urine and empty it completely because urination is a very automated phenomenon. The bladder contracts, the passage open, urine comes out. You press the button and the remote TV gets on. It's so automated. Don't destroy the automation just by postponing urine because then you could stretch the muscle too much. The bladder has enormous capacity to stretch and expand to the master. And all of you are masters to your bladder. It stores urine till you conveniently find a place to pass urine or void. If that is what is happening, let's keep the mastering here. But continence or control mechanism can sometimes go wrong, which means that the bladder holds, there is sphincter muscle which controls urine, like the door is closed, like the zip is something which is closing something. That continence mechanism can go wrong. And it goes wrong in women because of umpteen reasons. I did point in the two cases around where the urinary cycle is all about filling in bladder. You can see the bladder gradually filling up. You had passed urine, then the fills up a little bit more, and then full bladder. And then you pass urine and the urine comes out. In other words, there's a complete balance. It's a balance that we live with. There's a balance of contraction and relaxation. When the bladder is relaxing gradually to adult capacity to 350 to 500 ml, the bladder then contracts because the sensation is strong. You go to the washroom. The bladder contracts and pushes urine out. What happens if the bladder doesn't contract? Before I go to overactive bladder, imagine I don't get up from this place. I will never reach outside. I walk and the door opens and I reach outside. Similarly, the bladder contracts because there's a sensation and the bladder pushes out. All those individuals who have got spine problems, born with spine problems or spine diseases or spinal trauma or accidents, all those people who have got brain issues, all those patients who have got long-standing diabetes, which brings about a disease called diabetic cystopathy, the bladder does not contract and empty well. And these women possibly may not have a bladder sensation at all. They may not be able to pass urine completely. That means the bladder possibly could be underactive rather than overactive. So that's another completely different phenomenon. Underactive bladder. All this while I talked about a case where a woman cannot control urine to a departmental store and she leaves a departmental store because the bladder is contracting. On the other side, there could be something called as underactive bladder. The bladder is underactive. It is sleeping and lazy. The bladder is too full. Bladder is almost pregnant, but does not sense urine. And that sadly happens in a long-standing diabetes. These women do pass urine by pushing the tummy and emptying the urine around. And that possibly happens to a lot of elderly women by multiple changes happening in the pelvis. So if somebody's bladder does not empty completely, there are only two reasons. Either the passage is closed or the bladder is not contracting. Not contracting or poorly contracting may not empty completely. And if that happens, the residual volume left over in the urine could be high. So if you do a sonography and there's a high residual volume left over in the urine, the possibility of bladder emptying mechanism going wrong is important. And therefore, when you see a urologist, he would ask you to do a uroflowmetry. Pass urine in a computerized toilet in the privacy of the toilet. He comes to know how you pass urine, how much urine stays back, and that is a real-time phenomenon compared to an ultrasound. So underactive bladder, again, is a sad issue of long-standing diabetics, of elderly women, of women who have got spine issues. There are spinal trauma, spinal surgeries, and brain issues. This can also happen in men and children too. Very important to know, underactive bladder. So as a result of this contraction and relaxation, the bladder is active the whole day. Like your heart is active every minute, 72 times a minute, contracts and relaxes. This activity have sometimes go wrong. I talk about overactive bladder, which translates into agony, anxiety, and expectations. Passing urine multiple times in the daytime. Sudden urge and cannot control urine, and sometimes leak urine, and therefore sadly wear diapers. Waking up multiple times at the night and passing urine. So these are aspects which significantly impact quality of life. Please believe me, all those women who see me and see urologists tell that I did not know all this. I did not know the subject. I was being treated. My urine reports were being treated rather than I was being treated. It's very important for us to wake up to this phenomena that we don't get into this trouble. So I was talking about overactivity where there's agony and translated into happenings. The overactivity of bladder can happen in urinary tract infection. Somebody develops a urinary tract infection, a burning, discomfort, pain, etc. The bladder becomes overactive because the bladder's inner lining is inflamed. Inflammation where there is a kind of an insult or a trauma as a result of bacteria going in and colonizing inside. The bacteria, the inner lining of the bladder contracts again and again. So all women with UTI may have to rush to washroom multiple times. They pass urine little, they pass with discomfort, pain, burning, and ineffectively, not that they empty completely. Many women would be sitting in the commode the whole night, more in honeymoon cystitis or in recurrent UTIs. That's overactivity of bladder because the bladder is contracting erratically and making you run again and again. I said bladder outflow obstruction. The urinary passage tightens up, or the bladder outlet itself is getting tightened up as a result of age. The bladder would then contract secondarily and contract and make urine empty. The door is closed. I'll busy knocking till the door opens up. So the door is closing down gradually in women who are perimenopausal, who don't empty their bladder completely. They would actually have to go and see a urologist. I did talk about this agonizing condition where there's so much of agony, desperation, and discomfort. Interstitial cystitis, bladder pain syndrome. Bladder filling up and giving pain. The reason is the inner lining of the bladder. I said inner lining of the mouth has got sensations. So the inner lining of the bladder has got sensations. And that sensation has gone completely wrong. That means the layers that actually layer up the bladder lining so that the interstitium is not exposed to the inflammation or to the urinary insult is now completely open. So inner lining of the bladder is denuded as a result of the loss of a scientific gag layer. And the patient continues to suffer with discomfort. The bladder fills up and gives a pain. The patient is living with cystitis all through the year. It only worsens up with UTI and various kinds of stress. Bladder pain syndrome is completely to be looked into. At the society that we have as an academic body called GIBS, Global Interstitial Cystitis Bladder Pain Syndrome, which emanates from the very city in Mumbai where I sit and talk about, we have a team that looks into it. Women who go through this agony actually open up GIBS website, gibs.org.in, and look at that and identify and probably see the doctors who are interested and probably treating you with interstitial cystitis bladder pain syndrome. That's a disease where the bladder is overactive. It's contracting again and again and making you run to the washroom, more in discomfort, more in pain. So you're passing 20 times in discomfort. And finally, overactivity of the bladder can happen in overactive bladder, a phenomenon which has no reason. The bladder has just got a little more shaitan than normal and just contracting erratically. Friends, urinary incontinence is all about multiple aspects. The incontinence could happen because the bladder is either contracting erratically or the passage is weak and it leaks out in stress incontinence. Overactive bladder is where the bladder is contracting and making you go again and again before the bladder is full. So you're going multiple times in the day and night, the bladder doesn't pardon you and you are rushing, you would leak urine. Even when you come from Star Bazaar and open your keys, you already leak urine because that's the last minute the bladder would let you hold. And that's a kind of phenomena which is mind and body games of women go through. And they continue to live in it. So today's wake-up call is that if you have overactive bladder, see your urologist. Get sorted out. Don't live with the agony. I did talk about stress incontinence as I come towards the close and wait for questions which could come up or comments which would come up. You are waking up to a phenomena called stress incontinence. I said this is exclusively in women. Men don't suffer from this unless I did an injury or an accident during surgery. It is exclusively women's natural phenomenon. Why so? Because of age-related changes, because of hormone-related changes, because of pelvic floor stretch happening as a result of delivery, as a result of multiple deliveries and forceps application. What happens is leakage of urine with minimal stress from walking, running, climbing stairs, exercise, bending, laughing, coughing. I did tell you that. It incapacitates women in all age groups, more so in the perimenopausal elderly age group. But I know many younger women after the first delivery, leaking so much urine, tried all exercises and Kegel's exercises. Nothing worked on them. They used diapers. Finally, they came here and got cured. So see your urologist if you have got stress incontinence. Your gynecologist is also interested. Probably she does the job. So it's important not to treat, but to completely treat. In other words, to cure you of incontinence, you need not get a pad. The important aspect is we need to prevent that happening around, because women go through quite a low self-esteem, strained relations, restricted lifestyle, embarrassment and isolation, wearing diapers, and live in what? Stress incontinence. This is treatable. To give her back her cure or her laughter, it's important that we give her the cure by not letting her leak urine anymore when she goes to the laughing parties now. Friends, female urinary incontinence is a very silent menace. I've seen women wearing diapers for 10 long years, possibly because she thought that surgery may do more harm. That's not true. It's only you who can help this menace to go away from the agony of women who go through it separately. I did talk about getting up multiple times at night. We were motivated at Kokilabenhospital 6 years ago to look at this aspect where elderly men and women actually get up multiple times at night. We know that they talk to their family physicians, talk to their gynecologists, talk to their physicians across, but that unmet need has always been there. Bedwetting in children between 6 to 15 years is so common. Mothers probably in the busy life forget, or they keep trying, but it does not happen. They see their pediatricians around. We were the first to build up country's first nocturia and bedwetting clinic. Not that we wanted to take anything out of it, but only to look at the silent and unmet need to be met. In other words, getting up multiple times at night, not getting a good sleep, being drowsy the next day, like the 57 years young CEO who doesn't know what to do to her, or bedwetting for very elderly people, or bedwetting for children. The impossible to possible was brought about. It was brought about for hundreds of individuals who just walk into the Kokilabenhospital's urology department and say, I get up multiple times at night. Do you have a treatment? Can you cure me, please? On the other side, they say, I bedwet every night. I bedwet twice a night, or I bedwet umpteen times. Or yesterday was the first time I had bedwetting. I'm very scared. I cannot travel. I cannot go to a hotel. And the kind of professions and lives we lead around, we travel around. It's quite a scare that I may do a bedwetting when I'm completely in sleep and I don't know what. I'm not going into depth of science, but it's a wake-up call that if individuals go through all this, then why suffer? Why suffer in agony and not get a therapy done? When we talk about campaign for incontinence, let's listen to somebody who says, as I got older, my incontinence became worse, which could happen both in stress incontinence as the pelvic floor turns weak, which could actually happen in overactive bladder, where overactive bladder prevalence goes higher in both men and women as they get gracefully aged. I'm so glad I did something about it and saw a urologist in the city where I live in. It could be any city. Now I can enjoy life again. So our overactive bladder is treated. Our interstitial cystitis bladder pain syndrome is brought down to a level where she doesn't have overactivity, pain, burning, etc. It's time for you to take charge. It's important for us to wake up to this phenomena where women can suffer from this more than men, and they need to take charge. Else, you continue to be treated with your urine culture reports or urine routine reports, which sadly are not the right specimen many women may not be giving. So it's important for us to give the right sample many a times. Friends, for all of us in our lives, failures are stepping stones to success. We all had it. But if we continue to do what we've always done, we will always get what we always got. And therefore, having come on this important platform created by Dr. Reddy's lab at the Kokilabenhospitalmumbai Hospital on a Sunday morning is a salute to all of you who thought that you should take charge. Not that any of you is a patient, but it's all about motivating yourself as being an ambassador in society for the societies you live in around, to the families you represent. It's important for understanding that women continue to suffer very silently, and silent sufferings are not as loud. If you have a cancer, you would get operated the next day. If you have a stone falling down, you would agree to get a treatment done, though silently stone was sitting in the kidney for months together. If you have a bleeding in urine, you don't sit home. That's dangerous. But if you have silent quality of life diseases like recurrent urinary infections, you're tired for months and years, being treated by family doctors who probably took it to the best possible level, but they also are our friends. They know when to treat and when to send it to us as urologists in the city and across the country. When you see a gynecologist who's a busy gynecologist taking care of mother and child health, she may not be able to take complete charge on urinary issues around. And therefore, the motto today is probably see your urologist in your city. So while I stimulate the society into nocturia to take it to the front row seat. I keep telling that it is important to treat this completely. We go a mile extra to look at the quality of life diseases where all these incontinence, infections, bladder pain syndrome, underactive bladder, nocturia, bedwetting, multiple times at night are situations which are really messed out. They could have been taken better provided we are awake. Friends, female urinary issues or incontinence or infections are real jigsaw puzzles. They cannot be solved in 45 minutes of understanding between you and me across the table. But we are on the threshold of solving this forever. In other words, as we get more and more aware, we identify ourselves in time. And only early identification is the truth of the moment. That means if you identify yourself in time on complaints in urinary issues, don't hold back. Don't pick up medicines that your friend told you. That's not right. Two patients are not the same. And you as a patient are not the same tomorrow and day after. As age changes, as the disease process changes around, you may not be the same what you were 10 years ago. So for me, it is important to wake up. Behind every successful man is a woman, and behind every successful urologist is a gynecologist. So we always a team with all gynecologists and all family physicians. But behind every successful incontinence program or female urinary programs is a very intricate teamwork. Teamwork that makes these kind of revolutions really worthy. Worthy because you participate, you take your messages home, you are aware. It's just an awareness call from a louder platform, which makes the intricate teamwork happen. To me, incontinence, infection, interstitial cystitis, I, all needs your efforts and attention, because all good things take time. It took time of the last 7 days of agony that I saw, that we started to bring this journey of 1,000 miles with a single step on Sunday morning from Kokilabenhospital to wake you up. As I come to a close, if there are any questions which have been typed in around, I would like to take those questions. If you think of urgency, that means you have an urgent desire which you cannot control and you have to go to the washroom or you have to wear diapers if you're in a public space. If you're already leaking urine because of the urgency that you just can't control and you don't know what to do next. If you think that you have got increased frequency of urination, you are a slave and a bladder is a master in making urine again and again, it is important to take charge. If you think of nocturia or getting up multiple times at night and sometimes you dribble urine after urination, I think it's time to see your urologist in your city. He's qualified enough. He does this 24/7. He has gone through the rubble of difficult patients and patients whom he treats and cures. See your urologist in your city. If you think you leak urine on coughing and laughing, bending down for namaz and probably getting upstairs, and you cannot take part in the laughter parties that you have, you're going through a disease called stress incontinence, not through your mistake. It's because a woman in her 30s, 40s, 50s, 60s, 70s sadly goes through it, but goes through it very silently. Think of World Incontinence Week reminders. Think of Women's Day, International Women's Day. Think of urologists across the tables who are interested in empowering women more and more. Friends, as I come to a close, in my end is my beginning, because we look forward to, in India, in incontinence and infections, in interstitial cystitis and in female urinary health, headlines from tomorrow, which means motivated Monday morning should change completely. That means you say, I love my urologist because he made me aware and he's probably treating and curing me. So wherever you live in this city, you possibly will get treated provided you take this forward. You need to be a reincarnate as much as we reincarnate ourselves and get into the subject of treating you. Incontinence, truly a challenge, awareness a dream, and management a satisfying journey. That this program has been aired on a live platform. I'm sure it would come back to me and I would put it on my YouTube channel for those who have missed out. But at the end of it, I look forward to taking this incontinence storm completely by taking it to the next level. I'm sure there could be some questions. I'm not sure whether I could see those questions. If anybody could type that questions to me here. But just to come to a close in the next few minutes, if there are any questions, Arvind and team, if you could type it here, please. I will not be able to see questions here. If there are none, I'm very happy about it. That means everybody understood what I spoke about. But on a motivated Sunday morning, a urologist participates with the audience, talks about urinary infection, which is more common to women, issues which women can have and which possibly needs to be treated completely. I'm talking about a cure and that's not treating alone. That means we can get these all treatments sorted out, provided we as individuals, we as people who suffer, reach our doctors in time. Now, whom to reach and when to reach is important. And therefore I said early identification is the truth of the moment. Sometimes it's you who has to make her own sunshine, because you happen to be the pilots of the plane that you drive. The problem is time flies, and the time flew in the last 45 minutes that we spoke to you. We only made you aware that urinary infections is more common in women. Let's not treat just by treating the urine routine and urine culture report many a time, which is sadly given in a very wrong manner. Always give a urine sample, which is a midstream and a clean cat specimen, which many women don't know. They give a sample, पहला पेशाब टॉयलेट में दे दिया और उसके बाद उसकी ट्रीटमेंट शुरू हो गई. Remember, the external part of the urinary passage is completely contaminated, and therefore it's very important to wake up. I can see first question coming up. Serving for the question. Doctor, the hygiene at washrooms in our country is not so good, compelling us to stand and pass urine or sit halfway. Does this result in urinary issues? A wonderful question. I would be thankful if there were such questions like this. This would miss my time completely. So ideally, not ideally, but by proportion, men stand and pass urine unless they sit and pass urine. Women sit and pass urine. It's just made that you don't want to get wet and don't want to get contaminated. Remember, washrooms across the world have got poor hygiene. They're not your puja rooms and your kitchens around. They are different places altogether. But for God's sake, bacteria is not sitting in a washroom that when you enter, the bacteria would run and jump into urinary passage. It's not true. So they may be smelling, they may be dirty looking, but there's no way a bacteria in those 45 seconds to 2 minutes that you sit on a commode would get into your washroom and cause infection to you. That's a wake-up call. In other words, I've been telling this to women folk who come in around and say that I don't want to go to washrooms. I don't drink water. When I go to a film or a TV shoot or when I go to work in a bank, I just don't drink water, doctor. And then I would come home and drink. What did you do? You stretch your bladder so much that your bladder has now gone to a non-elastic levels. Imagine a balloon that you buy. A balloon on your birthday is a small virgin balloon. You inflate it with air and the air is making the balloon look beautiful. And there are so many balloons on the day that you want to celebrate. If you keep the balloon stretched with air, remove the air or the gas after 5 days. Look at the balloon, what happens to it. The balloon is stretched beyond it. It cannot recoil to the balloon that you bought. What does it mean? You stretch it beyond a point in time. So if you're going to stretch your bladder to a point where the bladder completely stretched and pulled across, then a bladder will never recoil. The whole aspect is bladder fills up, contracts, recoils, fills up, recoils, like your heart recoils 72 times per minute. And if you don't let it recoil, in other words, you stretch this, the bladder then would have loss of sensations. You are holding a large capacity pregnant bladder instead of a pregnant uterus. The bladder doesn't empty completely. You'll end up with infections and you are into a completely irreversible angle. Remember, not everything can be reversed with medicines or by doctors. There are times beyond which a doctor may say, sorry, I can't treat you. Therefore, early identification is very important for you. For all women who think that the washroom is dirty and infection happens because of dirty washrooms, you know why infections happen when you go to dirty washroom? Let me explain to you. Imagine in the city of Mumbai, from the drive from Lonavala to Mumbai, there's only one washroom where women can pass urine. That women's toilet in the midway is possibly a dirty washroom, as somebody said. Now, women do go and pass urine only when the bladder is too full. Remember all the time. That means they would go to a public toilet when the bladder is too full and they want to pass urine. They're waiting in a queue and the queue is long when you drive from Lonavala, you see that. That's sad. So if that happens around and the bladder is too full, then there's no way that you would possibly be able to empty your urine. You would trickle some urine in the undergarment, and that environment of wet introitus and wet undergarments is easy for the bacteria to use that as a ladder and walk up into the urinary passage. So hygiene of that area, which is introitus or the urinary passage opening, itself is on the lower side, demanded because there are bacteria sitting there all the time. So the no bacteria sitting down in the washroom will jump into and cause infections. Women say, we went on a tour and a holiday and we got infected. It was not a dirty toilet. It possibly was you were postponing urine too much. You postpone urine till a point in time, you go to a washroom, which is a public toilet to you. When you go there, you already wet a bit, undergarments already wet, the urine is all there, and the bacteria and easily can climb over in that ladder that they want. They want a ladder of wetness out there, whereas you maintain a great hygiene under normal conditions. So it is not the washroom to be dirty or washroom to be, you got to time your bladder. You got to empty your urine before you leave into the traffic of Mumbai, where you can sometimes get lost. So standing and passing urine is acceptable. That's one way of doing which you want to do. That's a great precaution. That's a great interim way you prevent yourself from getting infected. But at the same time, urinary infection does not happen because public toilets are very dirty. All toilets in the world are dirty, including our private toilets too. That's important. So urinary issues happens when the question was, does it result in urinary issues? Yes, it results in urinary issue because you stretch your bladder till a point in time that you are forced to go to a public toilet, that too on demand, number one. Number two, urinary infections can happen when the undergarment is soiled and when there is a lot of urine leaked already around. That's something which may not be visible to you. So to me, it is important to prevent those aspects completely. Sir, after operation also, if bladder is still overactive, what next step need to do? So after what operation did bladder get overactive? After pelvic surgery, bladder can get overactive. After bladder surgery, the bladder can get overactive. After incontinence surgery, bladder can get a new onset overactivity. If that happens around, your urologist is qualified. He looks at whether the bladder is emptying or not. Whenever somebody comes with an overactive bladder phenomenon, that means cannot control urine, the first thing your urologist sees is, are you emptying your bladder or not? You should not be something called as an incontinence where the bladder is too full. That means you are overfilled and then you are emptying urine. That should not happen, which could happen in poor sensations of diabetes, etc. So the bladder is emptying completely. Then your urologist is qualified to give you anticholinergics and beta-3 agonists, medicines which could help you out. So if there is a bladder overactivity, a urologist looks into that, identifies the cause, and I always said, we always try to quench the fire and probably dab the fire rather than looking at the smoke, which is a result of the fire. We always look at your complaints with a lot of diligence, with a lot of understanding. At the same time, identify the cause of it. Just treating a urine culture report will not treat your UTI. One needs to identify the cause and set the cause right, number one. Similarly, overactive bladder, I have said, can be idiopathic phenomena, but can also result from overactivity. And overactivity can happen because of UTI. Overactivity can happen because of OAB or overactive bladder. Overactivity happen because of interstitial cystitis bladder pain syndrome. It can happen because of bladder outflow obstruction. And therefore, we check whether the bladder is emptying or not. So as I come to a close in female urinary issues, it was only to motivate individuals in the society who happen to be women, because the good news is once aware about the issue, you reach the right doctor and probably get yourself treated. That's important for you. So is it safe to use P-Safe for outside toilets while traveling or going outside? Yes, you can. I mean, to maintain hygiene by any kind of hygiene maintenance around is possible. Some women who may not be capable enough, economically challenged around, may not be able to use V-Wash and P-Safe, would just use soap and water, may just use water. There are regions where you will have to wash up multiple times a day after passing urine, because God's told them to probably keep the lower passage very clear. They may not get urinary infection compared to others who may land up with infection again and again. So the aspects here are to wake people up. For individuals who have got trouble, they must see their urologist, because it is important for us to wake up to it. So all women in this country and the world who continue to suffer infections, urinary infections, kindly give a right urinary sample, which is a midstream and a clean cat specimen. Clean the lower area very well. Only give the middle part of urine into the bottle, both for routine as well as culture. Please don't go by the word called pus cells. Pus cells are not pus. Pus cells are inflammatory cells or WBCs, like you have RBCs in urine, you've got pus cells or WBCs in urine, which talk about an inflammatory component in the urine. That means if you have a catheter, if you have a stent in the urinary passage, if you have a stone in the urinary passage, you may have excessive amount of pus cells in the urine. And kindly don't go with pus cells, because people come and say, "Mere ko bahut zyada pus ho raha urine mein, pus cells." That's not true. Pus cells are inflammatory cells, as something we need to look into. That's one. So give proper urine routine and cultures. The doctor will start you on symptomatic care where your burning and pain is taken care of. If it's progressive, he may give you one shot of an oral antibiotic. He will watch you for 3 days very closely. If your infection is progressing, if there's fever and chills, you won't sit home. You would see your doctor again. Many times your doctor could be urologist, or could be family physician, or could be gynecologist. At the end of it, you have to reincarnate yourself towards a treatment and towards a cure. How can we control UTI infection? You control UTI, but not let a UTI happen. Women are sitting at threshold of getting urinary tract infection, and to prevent that, hygiene all the time. Therefore, it's important for us to maintain a great hygiene in the lower part, change undergarments, drink good amount of water, not have urine which is very highly concentrated. And that's the way you look at urine. Sadly, urine has never been discussed with women. Women never get a chance to discuss urinary issues. Sometimes women unfortunately leak urine from the vagina, which is called a vesicovaginal fistula, which is post-surgery, post-delivery, post-trauma, something which you operate and cure. So on one side, your urologist takes charge, identifies you, looks at your infections, causes of infection, treats you and cures you. On the side, there are disabling diseases which progress called interstitial cystitis bladder pain syndrome, where when the bladder fills up and you get pain and discomfort and you don't know what to do. That's the time you need to see your urologist who is interested in the subject. It is important for us to identify that if that happens around, I won't sit tight. I've got pain on bladder filling. I've got burning sensation in the lower part, pain and discomfort, which I can't describe to anybody. I must go and see my urologist. I may be having interstitial cystitis bladder pain syndrome. You're aware of that when you open up GIBS, GIBS as a society. There are patients forum which tell you more about it. There are doctors who are keen to see in your cities and help you out. Women who develop overactive bladder, which is part and parcel of a mature age group towards geriatric age group, overactive bladder can be tamed completely. एक शैतान बच्चा अगर ऐसे बार-बार contact कर रहा है, we can tame it down and bring it to a lower levels. So finally, the interest today was to wake you all up on issues which you go through. And let me not forget that last week we operated 3 women who had stress incontinence for months and years. They were leaking urine and wearing diapers. They finally have got cured. They walked out of this hospital completely dry and cured. And therefore, the wake-up call today is to look at if you have stress incontinence, that means when you cough, jump, run, and leak urine even by laughing, I think you're going through that important disease called stress incontinence. It's just not age-related. It's just not to be left on diapers and getting recurrent UTIs and smelling of urine and develop various kinds of skin infections down there. And then have to see a skin doctor and then to see a gynecologist. You got to nip it in the bud. That means you got to see your urologist in your city, get it sorted and get it cured. If you always do what you've always done, you'll always get what you've always got. And now if you do what you have done today in the last 1 hour, you got yourself aware. Female urinary issues cannot be taken lightly. There are days which are International Women's Day. There are Incontinence Week where we come back to you from wonderful platforms at Kokilabenhospital and Dr. Reddy's lab and speak to you and make you aware again and again. So awareness is the key. Identification is the truth of the moment. And we come to a close today on this wonderful Sunday. Have a great Sunday. And look at women urinary issues from motivated Monday mornings will be treated and cured forever. Thank you so much. Have a great day.